naturalistic observations in public place. You just want to observe. Okay, your research study about is just about observe some naturalistic public place, and the related image or related video will not create any potential harm. Okay, you have to know that your video just nature, or your image are just related to the nature or observations in the public that will not cause any harm to any identifiable people, then you can waive. Okay, you can waive the consent form. You are taking some image of people, if you are recording some video of people, then you need to get the consent. Okay? Am I going too fast? No, right? Okay, so next one, if you have research study, include deception. We already learned. So if you are hiding some information, you are lying, or you are undisclosed some information, involves deception, or in the consents for the use of recording is obtained during debriefing. So debriefing is an attitude that you want to tell your participants what are all the undisclosed information. You remember the term debriefing? So you tell them what you are hiding at the end of the research. You disclose everything to them. So in this situation, usually we will prefer video recording or voice recording. Okay, to make sure that to support you, you already give all the explanation, or you have already performed this standard protocol. Okay, at the end of the research study. So this one you have to pay attention if you are involved any research in the social and behavior study. So dispense with informed consent. So as I mentioned, in certain case you can waive, okay, or eliminate the need of the informed consent. So especially if you are doing some, but at the first point you cannot create any harm. Okay, the risk have to be reduced to the minimal risk. Okay, so if you involve any risk in your research study, you cannot waive. Okay, you remember we have gone through in what situation we can waive, apply for waiver of the informed consent. So it should be has very low to minimal of the risk, okay, potential risk. So if you perform some study involve some educational, okay, practice, or some classroom management method, conducting persons' employability or reputations, and confidential is protected. Okay, you need to, if your study is able to fulfill this criteria, so you can apply for the waiver or dispense of the informed consent. So if your study involve any study factor related to job or organizations, effectiveness conduct in organization setting, okay, within an organization setting where there is no risk to the participants on employment and confidential is related. Remember, we can actually perform some research study, okay, without ethics if it is actually permitted by law or it is requested by an organization. Okay, so if you are actually, it is an instruction, it is permitted by the law, or it is an instruction by the court, okay, or it is under some job organization, so you have actually no right to, you can actually apply for the waiver of the informed consent. So ethical guideline in the social behavior also do include, okay, all these terms where we do not actually allow concession. Okay, so please understand all these terms that usually we already gone through in our previous lecture. Concession is without any threaten or any forcement during the withdrawal. Okay, do not influence if the participants on the what are the consequences. Okay, later if they withdraw or they are declining to continue, okay, in your research study, so we cannot allow. Okay, and inducement do not actually offer a lot of attractive, okay, inappropriate or excessive or inappropriate influence, okay, influence to the participants to affect their decision, okay, to make them to affect their judgment, okay. And then deception, deceiving, okay, do not lie or do not hide any potential risk effect or adverse effect during recruitment, okay, during the recruiting of participants. You cannot actually, you have to tell them the truth, what are the physical pain or what are the possible emotional distress, okay, that will be involved in your social and behavior study. And debriefing, tell them, okay, if you are hiding some information from them, make sure you give them a clear debriefing, okay, tell them what are the informations we are not disclosed in during the consent procedure. And during the debriefing, you need to make sure that they has the right to withdraw from your consent or withdraw from your study, or they can actually withdraw, okay, refuse to let you to publish their data, okay. They have the right that, okay, since you are hiding something from me, so since you did not tell me the truth from the beginning of your research study, so I do not want you to share to publish my result, okay, please exclude my result from your publications or report, okay. They have the right to do so. So next one we will go into the genetics research, okay. The first one we have gone through the social and behavior study. So next one we will see what are the attention, okay, what are the concern you need to pay extra for, more cautious if you perform some genetic research, okay, in your study. So any kind of genetic research involve diagnosis, screening, prediction, involving all the genetics, okay, all the DNA, RNA, all the gene knowledge. So you require extra cautions or attention during your ethics procedure. So this also involves pharmacogenetics. So if you are studying some drug, the effect of certain drug on your genetic changes, okay, on your genetic makeup changes or on your genetics influence. So it's categorized under pharmacogenetics. And if your study involves genetic modification, okay, without any drug, just want to include any factor that affect, like you keep having some unhealthy food, will it affect your genetics modification changes? Okay, so in this kind of experiment, so you need to pay attention. Okay, any research involves some genetics information. So you need to make sure that how are you going to use? You need to let your participants to know how are you going to use all these kind of genetics results. Okay, and then you need to make sure that clearly emphasize in your consent form the use of the genetics result, and also the access. Who are the person can access all these kind of result involve your genetics information. This is the reason we want to protect from any ethical issue, okay, including discriminations or all the society problem, okay, which will be involved after the disclosure, okay, after the disclosure of all the genetic information. So usually we will have different kinds of ethical issue, especially in paternity determination, okay, and then we have some genetic predisposition study, okay. So what is genetic predispositional study? So it is different from genetic study. Genetic study is the one when you born or deliver, you have some defect in your gene, right, that will create the disease, such as we have the Huntington disease or some chronic respiratory disease, okay. So which is actually the defect on the gene will directly cause the genetic disease. But predispositional disease is the genetic changes that it may cause the disease, but it needs the contributions of another factor, okay. It is not really confirmed that it will cause the disease, but it is very likely okay, it is very likely to cause the disease if you still practicing some not healthy, unhealthy behavior. Okay, for example, diabetes. Okay, so you are not born to identify with diabetes disease, right? Or asthma. Okay, so it may due to several factors, and these genetic predispositions can actually, the doctor can be aware from your history, family history disease. Okay, they can screen from your family history disease. Oh, you are very likely to have the chance to develop diabetes. So you need to make sure that you pay attention to your diet and to your lifestyle practice. Okay, but if you still continue to practice all the unhealthy behavior, you are more likely to develop the diabetes. But it is not 100% sure. So it will need the contributions of several other factors. Okay, like asthma may be due to the smoking. Okay, if you are very high possibility to develop asthma, but it may due to your normal lifestyle practice. Okay, so if you are not practicing well, so it is very likely for you to develop that disease. So for all informations related to genetic predisposition, okay, so actually we are not allowed to disclose to the social access. Please make sure that although it is not a genetic disease, so any informations related to the genetic predisposition, okay, we are not allowed to disclose to the employment or to the health insurance. We cannot simply share. Okay, this will affect actually your employment. Okay, maybe the company not really like, okay, oh, they have some prejudice that, oh, you have some genetic predispositional problem, so I'm not really keen to recruit you into my company. Or company health insurance will actually consider, okay, against your insurance coverage based on all these factors. Okay, that's why insurance company will never request you to do genetic analysis, right? They will just request you to do some health screen, but they will never request for your genetic predisposition. So this one we should keep it privacy and confidentiality. So some genetic predisposition include certain habits like alcohol abuse. So if you are a boss, a CEO of a company, so if you found that this person has some genetic predisposition of alcohol abuse, are you willing to recruit them? No, right? So you recruit another one with a more healthy or better lifestyle. Right? So this one, all this we should not disclose to prevent possible discrimination, okay, or prejudice. And then the next one, ethical issue also can be arise from the human embryo research. This is what you have done in your assignment number 1. Okay, what are all the ethical issues involved for the designer baby? Okay, so please be cautious if you are conducting all this research using the genetic study. So the participants that you recruited in your genetic research, so they have the right to be informed about the control and the use of the tissues and the data. So you need to emphasize in this part how to use all their data, who can access. Okay, they have the right to decide who may know their details of their genome. Okay, all the genetics DNA, they have the right to decide who I want to disclose, who you can disclose, and who cannot you disclose. Okay, and they have the right not to know. Okay, participants carrying a defective gene may view themselves as a defective. So this one is their own right, they want to know the result or not. So you no need to strongly inform them. Okay, you may ask them, after your research study, you obtain some genetic result, right? Genetic information. You may ask them whether they want to know or not. Okay, the result. If they say no, I'm not concerned and I don't know what is all this kind of genetic information about. Okay, so they have the right not to know. Don't go and straight them, no, you need to know. This one is very related to you and something like that. Okay, if they don't want to know, usually participants will contact you if they're interested to know their result. Okay, they have the right to decide who to know their genome, and they have the right not to know. If they are not really keen or not really concerned on their result, so they have the right not to know, because sometimes they will not it will create some harm for them, because they are not truly understand the risk. Okay, so they will think that, oh, I'm carrying a defective gene, so I'm not they will consider them as a defective person and will be harmed by various kind of emotional distress, okay, or some anxious, okay, on all these kind of information. So in broad sense, for the ethical requirement in the genetic study, so please make sure that the genetics information not to be disclosed without any individual consent. This one is very important, okay? Please make sure all the informations are not. So you need to put emphasis on this field against the privacy, disclosures of information, who can access all the genetic information. Okay, and confidentiality. Confidentiality of genetic information should be protected no matter who obtains or maintain the information. No matter who is the one manage the information, so you need to make sure you have a tighter security. Okay, tighter control the access. Not every of your team member has the access. Okay, you have a need to regulate some standard to tighten the security to prevent the disclosure of all this information. Okay, so the participants inside a valid consent form. So the participants should be told on your sample DNA or any genetics information what are the specific use. Okay, what are the specific use of your genetic sample or tissue or your DNA information, and what are the storage, what are the way to store your genetics tissue or your sample, and the durations of storage. This one you need to emphasize, and who can access and in what condition. Who can access all your sample, all your DNA sample, or all your information. You need to clearly state and emphasize in the consent form, and you need to include some uncertainty in your consent form. You need to include some statement of uncertainty. Why do we need uncertainty? To reduce the harm, okay, to the participants. For example, so after your research study involves genetic, so you found out that this patient has some gene modification that's strongly associated to a specific disease. Okay, but you need to state in your consent form that this is not the final outcome, because you are conducting a research study, right? So you may just want to know the correlation on the genetic changes on a certain disease. But are you sure that the changes are the one direct contribute to the disease? No, right? So this will make some anxious or some emotional stress to the participants. So you need to include a statement of uncertainty. No, this is not really means that you will develop that kind of disease. So you need to do more tests, okay, more diagnosis. So this one is just one of the research studies showing that your gene, okay, is highly expressed compared to the other participants. But this will not cause our research study cannot conclude that you really will develop that kinds of disease. So you need to include some uncertainty. You need to do further investigation, further diagnosis, okay, to find out, okay, what are the associations on the genetic information. Okay, so this one you need to include the uncertainty. If you going to perform some research study using some genetic information, okay, and in the valid informed consent, you need to make sure, okay, it is important for you to obtain consent for future use. Okay, remember there are several cases that we cannot opt out the informed consent. Okay, so usually the examples are involve some genetic study, human embryo study, paternity test, or some you want to use the patient's tissue to create some cell line. Okay, remember we have already learned in our previous lecture. So we have to get consent. Anyway, if you want to use their sample or use their DNA in the future study, you must get their consent. We cannot say that last time you already consent, so I want to use in the future. Okay, so you need to make sure you get the consent using if you are involved some genetic information, and if you have trouble in getting the consent, so at the starting point you need to do a better, broader consent. Okay, broad consent, broad informed consent, to include what are the future aspects you want to use all this kind of information. Okay, so you need to stand by. Okay, back up some procedure for some unexpected use, unexpected future use of all these genetic information. So all this you need to state, okay, in your consent form, and then you have to state also the participants or the subject has the right to consent or to object any particular use, or if they are refused, no, I don't want to use for my sample in future genetic screen. Okay, involve some disease, so you cannot use. Okay, they have the right to consent, agree, and they have the right to reject. Okay, any particular use using their sample or their DNA information. Okay, so in order to reduce or to minimize all the ethical issue arise from the genetic study, we have some suggestion, okay, for you how to minimize. So you can actually do some anonymous screening, okay, reduce all the identifiable information. Okay, so if you want to do some epidemiology study, okay, in a population, so you can actually using some anonymous screening to reduce all the ethical complications or ethical issue, okay, that will be arise. Okay, and then your research should not be disclosed to any employer or any insurance or any individual without the participants' consent. Okay, this one make sure you remember in order to avoid any possible discrimination, not to disclose any information to the company, employer, or healthcare insurance, okay, without the individual consent. So this one is illegal. Okay, so and each entity that receive or maintain or release of the genetic information must have a standard procedure. This is what I mentioned, that the way to tighten, the way to regulate the access. Okay, each entity that receive the information or maintain the information, you need to have a procedure, not simply that they can get access the information. Maybe you can ask them to fill up the form if you want to access the information. Before you give them the passcode or password to them, you need to ask them to sign some consent that they will not disclose all the information after they access the information. Otherwise, they will be subjected to some punishment or bring to court. Okay, so let them sign first. There are some regulation, okay, some procedure to make sure that they are aware. Okay, they are bearing some responsibility before they access all those kind of information. So next one, participants have control over which parts of their medical records or genetic data are available to which people. Okay, so they has the right to control who can access my information, who can you share my information. Even your spouse, okay, your husband or wife. Okay, we cannot simply share your genetic information without the participants' consent. So before you want to sharing, oh, your wife have this kind of genetic predispositional matter, okay, issue. Can you simply share these information to your children or to your husband or wife? No, okay? You need to get consent first from the participant. Can we share this information? Or if possible, the participants will share. Okay, he or she has the right to share this kind of information to relative or to the family, and we will see. Okay, and you need to actually prepare some educational or counseling. Okay, should be followed up after releasing her genetic information. So this is the reason why we state that funder or sponsor, okay, need to back up your research study. In the case that where they need some extra care, extra counseling, or extra some education, okay, all these fund can back up from your sponsor or your collaborator. You need to make sure that they can receive this kind of information or further counseling if they realize that they have something wrong with their genetic information. If they wanted to know lah. So if they're not interested to know, then never mind. But if they wanted to know the result and they cannot accept, okay, they feel anxious or the results has already triggered their emotional changes or emotional distress, so you need to provide them a proper counseling session. And if available, treatments or prevention should be offered. Okay, if they really cannot accept or having some stress with all the knowledge or all the information they receive, so you need to give some treatment. Okay, refer them to the psychology or psychiatry or offer any stabilizer, okay, to them with a minimum of delay. So do not reveal genetic information about a participant's carrier status to the patient's spouse. Okay, this which I already mentioned, do not simply share, even though the participants are just a carrier. Okay, you know carrier, meaning that there has less likely of chance to develop a certain disease. Okay, a certain disease will need a recessive of the gene. So they are carrier, actually they are considered as normal. Just they carry the certain gene that which may cause some genetic disease in their future generation. Okay, so even though they are carrier or what, so you cannot simply disclose, okay, to those information to the close partner without their permission, and then you can actually discuss with them, encourage them to share with their family, and encourage them to share with their relative. Why? Why encourage them to share? Don't keep everything on themselves, right? And if the disease, genetic disease, is curable or treatable, they have some treatments or some drug to treat. So you can share with your family or with your spouse, because to share their burden, to share, relieve their emotional or to relieve their feeling. Okay, so this can actually decrease the risk. Okay, minimal the risk to the participant. But you cannot simply share those information. You can discuss and encourage them to share. If they are willing, they can share to their relative and family, but you are not the person to distribute the information. Okay, so next one, the last one we have is the breach confidentiality. Okay, so in certain case, so always we say that we have some exceptional. Okay, so in the case that you really cannot avoid, okay, and you need to breach the confidentiality and disclose all the genetic risks to the relative. Okay, you are able to do so, but not encouraged. Okay, only under certain circumstances you can do so. Okay, so under which, if you fail to elicit voluntary disclosure, okay, such as HIV disease, so you should tell your spouse or your closer partner about this kind of sexually transmitted disease, but you fail to persuade the participants to inform his or her husband or wife. So in this situation, you has the right to breach the confidentiality to reduce the direct harm, okay, on the spouse. Okay, can you all get me? Okay, okay, right. So in certain case, you can actually breach the confidentiality or disclosing some genetic risk to the relative or family. So next one, there is a high probability of irreversible or fatal harm to the relative or family. So you know that if you undisclose, those informations is actually will create some irreversible harm, very high risk of harm or fatal harm to the relative. Then you have no choice, you have to tell the secret. Okay, so next one, the disclosure of information will prevent harm. Okay, so if you feel that it already will create certain harm to the relative or family, so you need to tell them. The disclosure is limited, but not simply share all those unnecessary information. Okay, just sharing to them those necessary for diagnosis or treatment. Encourage them. Okay, so your family have this kind of issue. So we encourage you to perform some diagnosis or some screening, okay, to find out. So in this way, you already disclose, right? Disclose some privacy of the participants. Just disclose some necessary information only. Not simply, okay, unlimitedly disclose all the genetic information. And if there is no other reasonable way to avert or revert the harm, there is really no choice for you, okay, to save the situations or to prevent the harm or to revert the harm. So in certain case, you can actually breach the confidentiality and disclose some the genetic information. Only under this kind of category, okay, and do not simply disclose all the unnecessary information. Okay, do you all need a break? Let's have 5 to 10 minutes break before we continue. Okay? Online already. Okay, so the next part we will go into is the elderly problem, meaning that all the aging, okay, or aging problem after the social and behavioral study and genetic study. Okay, so another research study you need to pay more attention is if you are recruiting some aging, okay, or elderly people in your research study. So usually elderly problem will have very complicated problem that usually they will have several like cognitive decline, connectivity decline, meaning recognition, okay? Declining in the ability of recognition, and then any kinds of research study, okay, involve the elderly people. You need to pay more attention during the informed consent form. So all the disease including the cardiovascular disease, hypertension, stroke, diabetes, and then the neurodegenerative disease, malnutrition, immune disorder, skin disease. Okay, any kind of this disease, if you are recruiting your participants of elderly, okay, among the elderly group, you need to pay attention on the ethics. So, certain kinds of researcher will have the preference to exclude the elderly in research. Why? What is the reason we will actually quite keen to exclude the elderly or aging people in research? Because usually they have located at a very high risk, okay, high risk of the range, okay, disease range, because of the comorbidities, because they might have more than one, okay, more than one types of disease problem, health problem, okay, like high blood pressure, diabetes, or hyperlipidemia, okay, in their blood. So usually this will have more. Usually elderly participants usually will have more adverse effects in any kinds of intervention study, and usually elderly people, they will have several medication, right, to control their blood pressure, to control their diabetes. So this will actually create more complication, okay, more complications in terms of obtaining a valid data in your research study, okay. And then elderly also have some problem with increased risk of mortality, okay, maybe during your research study, okay, they have some irreversible harm, okay, of losing their life or death, okay, during your research study, and they usually have higher dropout rate, okay, usually simply during in the middle they say I'm feeling very discomfort during your research study, so I want to withdraw, okay. You always, if any research study involves some elderly, will have higher probability, okay, higher probability of the dropout rate. And the exclusion, actually not saying bad, exclusions of the elderly can actually provide a more accuracy of the finding, okay, because due to all the complication, all the several medications that may influence your intervention, okay, or all the comorbidities, all the disease may actually complicate, okay, the results finding. So actually, if you want to exclude the elderly, so it may provide more accurate finding. Okay, more accurate in terms of your research data. Inclusion, it is also has benefit. If you include the elderly in your research study, it actually can provide, give you better generalizability, okay, more general, meaning that your intervention may not only work in the adults, so it's also work in the elderly, okay, or older generation. So next one we go to, and then also usually elderly have some transportations and mobility problem. They are not really able to follow up, okay, during your research, and they need some. They have also have some social isolations and community difficulties. Maybe they do not able to understand so well on your explanation, and they have some visual or hearing impairment. So all these are the factors that you can actually justify why you want to exclude elderly. What are the reasons that you want to exclude elderly from your research? So elderly are actually considered as one of the vulnerable group. So what is the meaning of vulnerable? So those are having higher risk. Okay, those populations or those participants are having a higher risk, okay, in your research study. So elderly is one type of vulnerable group in the research. And what are the example of vulnerable group in research study? Populations with excuse me, populations with higher risk. Pregnancy women, yes, pregnancy women, or terminally ill patient at the end stage, already very ill, severely ill. Okay, and then usually elderly will actually institutionalized, meaning that usually they are can be found in nursing home or caring institute, home care, okay, or hospitalized, okay, and they have varying degree of dementia and varying degrees of dependency. So if you want to recruit elderly in your research group, you have to consider, okay, all these factors because they may have cannot remember, okay, they have some different degree of dementia, and they always need to depend someone, okay, to bring them for the follow up, okay. So the ethical issue in aging research, so you can actually exclude the elderly if you can provide a better justification. For example, your drug is really high risk and it may actually increase the mortality of the elderly. Okay, so if you don't want to harm them, so you can try to exclude the elderly from your research population. But do not actually exclude elderly just based on convenience. You want your research study easy to settle, easy to initiate, easy to just for your convenience set, because they are very hard to communicate, so I don't want to include them. So you need to provide a justification, not to simply exclude them, or I don't want to because they are very burdensome, need to depends on the family to transport them for follow up, so I don't want to include them. Or very hard, I need to provide a special version of consent form for them. You know, sometimes you need to prepare your consent form in 3 different language. Okay, now your assignment is just preparing in English, right? You are preparing the consent form in English, right? For those who are very hard to communicate in English, they may need a Malay version, right? Right? Or some participants may prefer a different language, Chinese language. Okay, consent form. So this one is all your concern, whether they can understand, they can communicate with you. So do not simply exclude them based on the convenience. We all know that they might a bit hard to communicate, okay, a bit hard to settle. But make sure you can provide a better justification, and actually you need to concern what are their problems direct from the elderly, okay, direct from the aging people, instead getting all the informations, or they are getting all their preference from their carer, okay, so or surrogate, okay, for one who taking care of them, so they will answer on behalf. These participants are not feeling well or feeling discomfort based on them. So this one is not a very good, it's a bad sign, okay. You cannot simply getting any informations from the other person, okay, who is taking care of the elderly. So even though it is difficult, try to communicate more, okay, be patient and get more information from them. And certain scientists are actually very sensitive when they deal with the elderly, okay, they are actually quite not saying fear, okay, and actually sensitive to elderly denial and fear, like they feel like they are burdened, and then they feel like I don't want to waste my time to communicate with them, they are not really helpful, and they always troublesome, okay. Please do not have this kind of mindset, and try your best, okay. If you want to recruit elderly in your research study, please please pay more attention and concern on what their need, okay. So what do you need to do if you want to recruit elderly in your experiment, in your research study? So you need to make sure that the elderly friendly document, you prepare all your documents in a elderly friendly, easy to understand, simplified, okay, version, no scientific jargon, and then be aware of any research that have any interventions that can cause distress or harm. Because they are elderly population, aging population, you need to make sure each procedure or each intervention has reduced harm, okay, do not cause any reduce any distress or harm to the elderly. Try to concern more what they need or what are they going to experience, okay, and then try to seek advice from a professional or experienced qualified clinician or social care staff. What do you need to pay extra care to the elderly if you are conducting research to them, okay. Give them more care, more concern on their discomfort and all the side effects. So the consent priority, So it is actually you can obtain the consent directly from the aging people or from the old people. They are legal, okay, to provide the consent, not like children. But in certain case, okay, so in certain case, if the elderly or the aging people having some connective problem, okay, they have some declining connective issue. So in that case, if you are unable to get the direct consent, so you need to actually get the dual consent. Okay, you need to get the direct assent from the elderly people, from the old people, and you need to get surrogate consent. So surrogate consents can either be family member or a representative, okay, legally authorized representative, okay, to give consents on behalf. Okay, so you need to pay attention in this case. You can get, so if the aging people are having in a very good condition, okay, but to be secure, we will prefer if you have any research study involve aging people or elderly, so try to get the dual consent, because sometimes they might have during your study the situation, okay, the behavior of the elderly group may have some influence, okay, on their cognitive ability. So an increasing of number of researchers believe that most people diagnostic with the mild or moderate dementia are capable of giving informed consent. Okay, so even though they have very mild or moderate, so in terms of ethical guideline, we still accept if they are able to give the consent. Okay, so if you see their conditions is getting worse and worse, try to get the dual consent. Okay, so and we have next group, okay, next group of people, not the elderly or aging people. So we have next group of vulnerable participants are those end of life research. If your study involve participants are categorized under this category, end of life of research. So you need to also pay extra concern, okay, extra cautious. So what are the participants are categorized under this category, end of life? So those involve dying participants, okay, patient. So this is what I mentioned just now, the terminally ill patient. Those who are having medical futility, meaning that they're already certified no more effective treatment. Any more treatments will not be effective to the patients anymore. Okay, so at this stage, the patients will be categorized under this study, and those patients are having only have the palliative care. Okay, those patients without any effective treatment, we are just let them to alleviate, so reducing their suffering. We are giving some drug for them to reduce their suffering and then improve their quality of life. Just let them to enjoy their remaining life. So in these types of research, so you need to pay attention, okay, pay cautions during your ethics. And usually we do not encourage you to recruit, okay, these patients at the end stage of the life in your research study, okay, except your research focus is only concentrates on the patient's view on dying, okay, or the way to improve the palliative care practice. So just a very small niche of research, you can recruit this kind of participants. Why we do not include them in other kinds of interventions or any kinds of procedure? Why it is not an appropriate choice to include those patients already at the end life in our research study? Because they already have no more, okay? It is appropriate to include them in your research if you want to investigate some effectiveness of your drug, right? Or certain drug treatment. Because they're already like very terminally ill, they will not give any more response, okay, against your interventions or your procedure. So it is not appropriate, like cause of the disease. If your study is want to study what are the cause of the disease, what is the treatment, what is the cure of your disease, or what is the effective cure of your drug. Okay, so all this kind of research is already inappropriate. Do not recruit them. Okay, unless you want to study their view or what are the any improvement in the year end terminal stage. Okay, that can be done. So should we recruit, should patient near the end of the life ever be asked to participate in any form of research? No. Okay, end of life. This is what I mentioned. Okay, we try to not to, okay, recruit them in our research. This is the reason, because the validity. How valid your information can be used if you recruit them in your research? Because they have different degree of pain, right? Different degrees of the scale, and they are not actually in the spiritual well-being. How well are they going to give you the valid, okay, valid results or output in your study? And valid. During your sample size recruitment, if you recruit this kind of people, you have to collaborate with different kinds of nursing care or nursing home or daycare center, even medical care or care home, to increase the sample size. So it is very hard for you to increase your get a valid sample size for your study. And what are the potential benefit to them of your study? That's why we do not encourage to recruit them, because your treatment or your interventions already no longer can provide benefit to them, right? They're already at the end stage of the life. They're already very seriously ill. So they have no direct benefit, then why not we want to burden them? And then we are using their time for our research, but the time is their remaining time. Okay, this is the reason they have limited time to live. That's why we don't want to troublesome them, and we don't want to burden them anymore. So these are the reasons that why we do not actually encourage you to recruit these participants in your research. And also they have some cognitive impairment. Okay, as you know, there may certain terminally ill patients may undertake some drug. Okay, where we known as the opioid drug. Okay, opioid treatment is certain treatment where we give the certain drug such as morphine, okay, to give to the patient to relieve their suffering or reduce their pain, although it is one of a kind of an additive drug. Okay, so if they already consume this kind of drug, okay, they're having some depression, so we might have some cognitive impairment. That's why we should not include them. And then we also have some problem in getting the consent as well. Okay, the dual consent. Because maybe after we already get their consent, so suddenly they are due to the drug, okay, due to the drug or due to the treatment, so they are suffering, so they are not really, they want to withdraw. Okay, or they are not cannot remember anymore they have ever give the direct consents to the physician. Okay, and you need to provide them the opportunity to withdraw, because usually we do not encourage, okay, the consumptions of multiple prescription during a research study. So, and the prescriptions of the opioid drug is not allowed because it may influence the valid results of your research. Okay, so once this population or these participants has entered this stage, okay, so once they have already start to taken some opioid drug to relieve their pain, so they are no longer suitable. Okay, because the use of this kind of treatment will make them having some limited ability, okay, of mental capability for their decision, lack of mental capability for decision making. That's why we do not encourage anymore the involvement of them in our research. Okay, last one, we have already covered, okay, the ethical requirements for pediatric study, and this is what we are going to do in your assignment number 2, to prepare a consent form, involve any interventions, any procedure, lifestyle or behavior study, involve children in hospital. Okay, so this one is not, you can get more information from the International Ethical Guideline in the PDF form, Ethical Guideline number 17. Okay, you can refer to there for more information, but the main point I already addressed, okay, in our recent tutorial class. Okay, thank you. No more any slide for this lesson. So we have our last lesson next week to wrap up. Okay, to wrap up everything, and we have our last tutorial. The following week will be your exam. Okay, will be your exam week already. Okay.